Hi, this is Dr. Kurt Woeller for Autism Recovery System.com. I want to welcome you to this lecture titled Top Reasons the Organic Acids Test is Needed for Every Individual with an Autism Spectrum Disorder, Special Needs Kids, Teenagers, Adults, and also those with attention deficit and attention deficit hyperactivity disorder. This test is very much applied to all of these individuals and others as well. But I just wanted to emphasize that the organic acid test is not just a test for somebody with an autism diagnosis. This information is applicable to many other types of conditions too. So I'm Dr. Kurt Woeller. I've been an integrative and functional medicine physician for over 2 decades. I've been a clinical educator for various lab companies. I do a tremendous amount of public speaking. I'm an author, educator, and a practicing clinician. I'm co-founder of Integrative Medicine Academy, which is an online training academy website for healthcare practitioners in different mastery courses related to integrative medicine. I'm also the director of Autism Recovery System, which is a biomedical intervention for autism educational resource website. And in my own practice, I work with autistic kids and certainly their families all over the world. And I've also worked with people with autoimmune, gastrointestinal, and neurological disorders. So we're going to talk a little bit about the organic acids test from Great Plains Laboratory. So first off, what are organic acids? Well, these are acids or organic compounds that contain carbon and hydrogen. So those are always going to be present. There can be oxygen, there can be nitrogen, sulfur, phosphorus, depending on the type of organic acid. Now, these are chemical compounds that all of us produce naturally as part of our body metabolism and biochemistry. When certain organic acids are very high, it can represent certain problems, like lactic acid can be high because of glucose metabolism issues, for example, or severe stress. Now, in autism, what's often seen elevated more so than in neurotypical individuals is elevation of certain organic acids, things that can be linked to digestive candida, bacteria, or even mitochondrial imbalances, for example. And that's what this slide is showing us, is all of these peaks are different organic acids. Not that they couldn't occur in a neurotypical person, but they seem to occur at much higher levels in the autistic individual. And in particular, what you find in a lot of autistic individuals is high levels of organic acids linked to candida, bacteria like Clostridia, oxalic acid, for example, and other metabolic imbalances. So the first reason to do an organic acid test from Great Plains is the ability to assess for the existence of different kinds of yeast organisms that could reside in the digestive tract, as well as candida. So page 1 of the OAT will give us a good representation of invasive candida from this arabinose marker. And then there are markers for mold, like number 4, number 2. Tartaric is linked to Aspergillus mold as well. So this gives us a good representation of overgrowth and in the invasive nature of candida and other fungus that's occurring within the gut. Now, we know that candida is a type of yeast, and that becomes invasive in the lining of the digestive tract. It grows these tentacles or these root structures that can actually lead to leaky gut. Arabinose on the organic acid test is representative of that candida invasion of the mucosal lining of the digestive system. So what's happening is candida produces enzymes that break down hyaluronic acid that can then lead to elevations of arabinose and even other organic acid compounds as well. What happens over time with elevated arabinose is there is a potential for what are called pentosidine and cross-linked proteins. And what these do is they damage amino acids in the body. They can damage proteins in the body. This can trigger oxidative stress. It can trigger inflammation in certain cases, and even autoimmune conditions where all of a sudden the immune system starts to see these compounds as something abnormal and it goes after them. The other thing that happens with these organisms is they can produce organic acids that inhibit the Krebs cycle. And the Krebs cycle is part of our mitochondria, our factory within our cells that make the energy currency that our body needs to perform properly. And so when we inhibit the Krebs cycle, we basically inhibit the ability to make adequate energy within the cells. And when I'm referencing the cells, what I mean is that's cells that could be in our cardiovascular system, our digestive system, our brain nervous system, even our immune system. The other thing that these organisms can do is they can produce alcohol or ethanol. Glucose is the main fuel source for yeast, and their end product is ethanol. Now, this is very common in autism where we see high levels of arabinose indicating high levels of invasive candida, and the autistic kids seem to be much more sensitive to the existence of the arabinose. Meaning what that can do is it can trigger behavioral problems, anxiety, emotional instability, sensory seeking behavior, strange behavior I've seen over the years. Hanging upside down on furniture, for example, or heightened seeking of masturbation, seeking pressure, silliness, goofiness, inappropriate laughter, acting drunk. That kind of makes sense in the fact that the end product of yeast metabolism of glucose is actually alcohol. So a lot of times with the use of antifungals, whether that's medication or botanicals, we can get an improvement in focusing and concentration, an improvement in language, an improvement in eye contact, and just environmental awareness. At the same time, seeing a reduction many times in digestive problems like bloating, gas, constipation. The second reason to do an organic acid test from Great Plains for individuals with autism is the important analysis of Clostridia toxins. Now, there are multiple species of Clostridia that can exist within the digestive system. Not all of them are pathogenic, but some are seriously problematic. Clostridium difficile is one of those. Now, here in the United States, there has been thousands of people that have died over the years because of serious Clostridial difficile infections. There's also a very high recurrence rate. They're difficult to treat. And these Clostridia bacteria that reside in the gut can produce different toxins. Now, the main ones that are recognized for inflammatory bowel disease are toxin A and toxin B. And what these do is they damage the lining of the gut. They can lead to leaky gut, lead to inflammation, sometimes bloody stools, and even something called pseudomembranous colitis. Pseudomembranous colitis is an inflammatory bowel disease of the large intestine. But not all of the Clostridia produce those toxins. In fact, there's many different types of Clostridia difficile. In fact, this particular chemical, HPHPA, is often elevated significantly in autistic individuals. It comes from Clostridia, but it doesn't really affect the gut. Instead, what it does is it affects the brain and nervous system. When you look at an organic acid test, there's 4 markers that are linked to Clostridia bacteria: 4-hydroxyphenylacetic, HPHPA, 4-creosol, and 3-indolacetic. You don't see 3-indolacetic that often. HPHPA is the most common. 4-creosol can actually be produced by C. difficile, but there's different strains of C. difficile. So There are strains that produce 4-creosol that don't really affect the gut, and there's strains of C. difficile that can produce those toxins A and B that can affect the gut. These toxins seem to have more of an effect outside the digestive system. And what they do is they can inhibit this enzyme called dopamine beta hydroxylase. That enzyme is responsible for converting dopamine to norepinephrine. We need that for attention and focusing, memory formation, for example. Too much dopamine that builds up causes an increase of homovanillic acid on the OAT test. Now, Clostridia difficile can produce 4-creosol. Other species of Clostridia produce the HPA. And this is really important because these particular toxins themselves can trigger behavioral issues, aggressive behavior, self-injurious behavior, irritability, and in some severe cases, those toxins have even triggered acute psychosis and schizophrenia. They manipulate dopamine, but there's an overlap between dopamine, serotonin, and norepinephrine, for example, as primary neurotransmitters. All of these can affect mood. All can affect cognitive function. Imbalances in serotonin, for example, can lead to anxiety or irritability, but so can norepinephrine. Problems in dopamine can lead to attention issues. So we can't just focus on one neurotransmitter. We have to have an understanding that these things there's an overlap, but the influence of Clostridia is significant. So a lot of times what you'll see with autistic individuals when the HPA or these other Clostridia markers are high, sometimes you'll see very high levels of the homovanillic acid or HVA marker, which is linked to excess dopamine. Stress, mental emotional stress, is often associated with that. So can pain, infections, or food sensitivities can also be stressors that lead to elevations of things like norepinephrine and other stress hormones and stress chemicals. So the organic acid test gives us a representation of neurotransmitter imbalances that could be associated with other problems like stress, like Clostridia bacteria, etc. Critical to get that. Excess dopamine in the brain or nervous system can actually trigger what's called apoptosis, which is the signaling to a cell to commit suicide, essentially. Dopamine O-quinone will rob the cell of glutathione and lead to neurodegeneration over time. Okay, and that can basically decrease the cell's ability, particularly within the nervous system, the cell's ability to render toxins less toxic. So we destroy our glutathione reserves, we're going to be more susceptible to chemical toxins in the cell. All of this can have an influence on what's called the autonomic nervous system, the balance between the parasympathetic and the sympathetic nervous systems. Think of this like the brake and the accelerator on your car. The sympathetic nervous system is often linked to what's called fight or flight. Parasympathetic is more like rest and digestion. Imbalances will lead to imbalances in emotion, attention, focusing, physical health, attention, panic disorders, anxiety, etc. Also, Clostridia produce something called propionic acid. And that acid itself can damage the Krebs cycle, therefore leading to mitochondrial problems. Reason number 3, the ability to prioritize treatment for yeast and/or Clostridia bacteria. What I've seen over the years is if people do not do the organic acid test and just assume that all problems are from a candida or yeast issue in the gut and not focus or not analyze for Clostridia bacteria, can lead to a lot of problems. There seems to be a relationship between these types of organisms in the digestive system. And so if we got Clostridia that's sitting there in the mix, and all you do is try and wipe out the yeast, you could see a rise in Clostridia. That could lead to agitation, aggression, self-injurious behavior, head banging, etc. So it's important to get the organic acid test to know exactly where you are, so you really know where to put your emphasis and what your prioritization is with regards to intervention. So here's a quick case example. This is a Clostridia-induced behavioral problems. So this is a 5-year-old boy at the time of visit. Okay, he was born via C-section, no complications, had a little bit of colic as an infant. Typical development up to the age of 10 months. But the parents did report he seemed to lack a need for physical contact. Breastfed for a year, then cow dairy and solids were introduced at around 6 months. Eye contact was okay up to about 11 months, and then it started to slowly disappear. Was playful and happy overall, was even engaging with his sibling. Physical milestones seemed to be fine at that point, babbling a little bit, but word development never came. Around 15 months, parents notified their pediatrician of their concerns regarding language. It was basically they were told that let's wait a little longer and just see how things go. Now, medical history had multiple ear infections during the first 2 years. In fact, mom mentioned it always seemed like he was on antibiotics for ear problems. Hard stools, needed periodic suppositories to have adequate bowel movements. Around 18 months, he developed an intestinal infection for about 3 days. Was given multiple doses of Tylenol, and it was no antibiotics, but it was felt to be probably a viral problem. Within 2 weeks after the onset of the fever and diarrhea, he seemed to be more agitated and irritable, and his appetite was changed. It just wasn't normal anymore. Within 20 months, basically disappeared significantly. No expressive language, poor social interaction, not interested in his sibling anymore, or even some of the neighborhood kids that used to come around. Became easily agitated, side glancing while standing close to the TV, hand flapping, finger twisting became his primary fixation. Now, they went to a neurologist, performed a Fragile X genetic test. It was normal, stated nothing else they could do, gave a diagnosis of autism. So the parents started researching themselves. Mom came across the casein-free diet information, implemented it, and saw immediate improvement in eye contact, began to sleep better too. Gluten, not any significant noticeable changes, or gluten-free diet I meant. Probiotics seemed to help, better stools, better mood. Started a multivitamin that had a high dose B6 in it, for example, got kind of hyper and agitated, so they stopped it. Overall, for the next year, things seemed to stabilize with regards to his autistic condition and overall physical health. At age 4, he developed an upper respiratory infection, went on antibiotics. Within the week of completing the treatment, he became unusually agitated and aggressive. This behavior went on and off for about 2 weeks, never fully went away though. Parents started implementing some botanicals like grapefruit seed extract on their own, did see some improvement in eye contact and lessened aggressive behavior. So I came on the scene, we did an organic acid test and saw very high levels of HPHBA linked to Clostridia bacteria. He also had invasive candida. So a lot of the behavior, particularly the negative behavior, really seemed to have a strong correlation to the Clostridia. Okay, what was interesting though in this particular case was the HVA level on the OAT was not high, which occurs sometimes. But another interesting finding was high levels of oxalic acid, which I'll talk about here in a second. So because of the severity of the situation, we decided to do an antibiotic called Flagyl, also called metronidazole. Put him on some nystatin, and at that time he was on some Clostridia, which was an older probiotic. Within 5 days of the Flagyl, okay, the aggression and irritability were completely gone. 3 weeks, he was happy, content, and playful. The nystatin was continued, the dairy-free diet was continued. They started to lower sugar content in the diet as well. Now, I had recommended to really address the high oxalates because high oxalates can contribute to behavioral issues too. Okay, over time they just kind of got lost to follow up, but I assume things progress from there. So the treatment for Clostridia was significant. Okay, because it shifted his behavior, and so we could tell that the aggression and irritability was definitely coming about because of the Clostridia. Let's talk about oxalate. That's another reason to do the organic acid test. There's a lot that goes into oxalate metabolism. Okay, oxalates are, again, organic compounds that our body can produce. But the main source of high oxalate that we see is through diet, eating foods that are high in oxalate, nuts, berries, spinach, soy, yeast, and fungus. Okay, what that means is yeast or mold, for example, including candida. One thing to keep in mind is that fungi, okay, the category fungi, with a biological group, I should say, includes yeast, also includes mold. Candida is a type of yeast. Okay, so when we talk about fungi, it's this large group of organisms that do include candida, other types of yeast, even mold. Now, B6 deficiencies can contribute to oxalates. And then there's different types of genetic factors as well that can lead to it. So foods that are high in oxalate, this is just a short list. So a lot of times we have to adjust diet in order to get the oxalates under control. Now, severe cases of oxalate, not something that's really going to occur in an autistic child, for example, it might occur in an adult over time, would be kidney stones. Oxalates can get into the brain. Oxalates can even accumulate in endocrine tissue like the thyroid gland. The organic acid test has 3 markers: oxalic, glycolic, glyceric. The oxalic we know is most commonly linked to diet, fungal contributions, for example. Glycolic and glyceric are usually linked to some kind of genetic imbalance. Low glycolic on this particular test is insignificant. Now, a lot of times I'll see levels come back extremely high because of diet. This actually is an organic acid example from a child in China. So I didn't know the child's diet, but I assumed that perhaps soy might have been something they were consuming a lot of. Candida. Candida actually has an enzyme called isocitrate lyase that grabs onto isocitrate to make oxalate. Okay, this is part of the Krebs cycle. So we know that candida can be a contributing factor to oxalic acid. Bladder irritability, pain on urination, urethral pain, vulvar pain, something that can occur in women, eye pain, body aches, fibromyalgia, tendon pain, trigger point tenderness. All of these things can be associated with high levels of oxalic acid in the body. And a lot of times with autistic individuals, when oxalates are problematic, they're usually creating some irritability, some kind of pain in the body. Diet is always essential to look at. Treating yeast if it's there. And then we can use things like calcium, magnesium supplements and probiotics and B6, for example. Oftentimes that's all that's needed. This was an interesting case. This was a teenage boy a number of years back who had a lot of body pain, also just very irritable and anxious, probably in some part brought about because of the physical pain. So we notice here that as arabinose is 110 and oxalic is very high at 291. Now, in this particular case, we did a number of different candida interventions over time, nystatin, botanicals, combinations of things. They also implemented a low oxalate diet. Okay, so January of that year, these were our markers. March, a few months later, we do see that the arabinose is coming down, but our oxalic level went up. Now that could occur because of just the body dumping or getting rid of oxalates, or it could be that perhaps maybe he had a high oxalate meal and didn't know it. But as time marched on, we see the arabinose dropping and the oxalic dropping again until later that year, both totally normalized. So it was a multi-month process. It wasn't something that just took place over a couple weeks. And this is also why it's important to repeat the organic acid test. Usually I'll have people repeat it 90 days after doing their initial one, after we've started some type of intervention. Reason number 5 to do the organic acid test is evaluating for mitochondrial dysfunction. And this is huge. Mitochondria are incredibly important. The brain and nervous system use a tremendous amount of this chemical called ATP. So does our gut, so does our cardiovascular system. All of our organ systems use this chemical. There are various factors that can lead to mitochondrial problems, from environmental chemicals and metals to vaccine reactions to poor nutrition, genetic factors like poor methylation, nutritional deficiencies, and even toxins like Clostridia. A lot of autistic kids, and teenagers and adults as well, have different imbalances in their Krebs cycle and overall mitochondrial sections of the OAT, which is on looking at glycolytic, Krebs cycle metabolites, and amino acid metabolites. Succinic levels are often linked to chemical heavy metal exposure. Elevated citric oftentimes has an association with poor antioxidant levels in the body, like poor glutathione status, for example. But it's known that the fungal toxins, Clostridia toxins, and the oxalate toxins can all themselves damage mitochondria. We know that mold toxins can do it too. We know that chemical toxins and heavy metals can lead to it. So that part of the test is very, very important to assess. Another reason is what's called folate metabolism. This is reason 6 to do the OAT test. There's a couple markers on the OAT that look at folate metabolism linked specifically to two chemicals, uracil and thymine. Now, these are linked to the base structure of DNA and RNA. But the OAT looks at uracil because it's representative of RNA levels, and then it looks at DNA with regards to thymine. And that's important, right? Because this is our genetic material, and our RNA translates and transcribes our DNA to make proteins. And those proteins are very important for our brain nervous system, our immune system, all over the place. So when we have a folate deficiency, it can compromise function at the DNA level, the genetic level. If you've studied at all a little bit about methylation, okay, I'm going to draw a line right here under homocysteine. Homocysteine, this little area is called methylation. Over here is our folate cycle, and this below the line is called transsulfuration. Methylation is where we're converting homocysteine to methionine. And the main enzyme that makes that happen is called methionine synthase, and that's where our B12 works, particularly methyl B12. That link, okay, that enzyme is the link between the folate and the methylation cycle. And the link happens because of this chemical called 5-methyl-THF. That's the active form of folate. Well, it turns out that other forms of folate go off to support our DNA and our RNA, okay? So on the OAT test, if we've got an elevated level of uracil and or thymine, it's telling us we've either got a conversion problem happening or perhaps a deficiency of folate. Now below this line is what's called transsulfuration, and it's linked to homocysteine. And what it does is it gets pulled into this pathway. We actually need B6, which can be measured on the OAT test as well. And it helps to support glutathione, that intracellular chemical that's needed as an antioxidant. It's also important in our liver for detoxification. So there's a relationship here between all of these cycles and systems. These things have to work in coordination. We can't just focus on one area and try and manipulate it. We have to understand really kind of what's going on from a universal standpoint. And the organic acid test gives us some insight into potential imbalances that could affect these systems. Reason number 7 is to look for different nutritional imbalances. Now the OAT test has a lot of markers that are either indirect or direct assessments of certain nutrients. So for example, methylmalonic acid, which is an organic acid, gets produced when we have a B12 deficiency. Methylcitric is an organic acid. When it's elevated, indicates a deficiency of biotin. But we do have a direct assessment for B5, pantothenic acid, B6, and even vitamin C. There's another marker that shows up on the nutritional marker section called vitamin Q10, which is CoQ10. This is an important marker because an elevation of this chemical right here indicates a deficiency of CoQ10. So an elevation of 3-hydroxy-3-methylglutaric indicates a CoQ10 deficiency. And that's a big deal because a CoQ10 deficiency can itself be linked to a mitochondrial issues. Reason number 8 is to assess for glutathione, inborn errors of metabolism, and phosphoric acid. Inborn errors of metabolism are fairly rare. These are more serious metabolic and genetic disorders that affect children. Phosphoric acid is a marker that often is linked to vitamin D status. We'll commonly see low values of phosphoric acid. The most common reason for that is a deficiency of vitamin D. High levels can occur. Now, most of the time, high levels of phosphoric, as you can see up here, is because of diet, because of high intake. And a lot of times it occurs because of drinking soda pop that has phosphoric acid in it. So vitamin D, which can be assessed itself through Great Plains, this is a blood spot, has a link to phosphoric acid. So lower levels of phosphoric often are linked to low levels of vitamin D. So those are just a few reasons why the organic acid test is so important. And in my experience over the past number of decades, this is a go-to test. To me, this has to be part of a testing profile. We have to get the accurate assessment for Clostridia. We have to get accurate assessment for mitochondrial markers in order to accurately assess other areas on the organic acid test and then correlate that information to the clinical presentation of the child, teenager, or adult. Again, it doesn't have to be just used in autism. These same things apply to individuals with attention problems, with hyperactivity issues, and it could even be applied to adults with similar types of problems. Now, there's a website called Lab Test Plus. LabTestPlus.com makes available access to many of the tests from Great Plains Laboratory, including the organic acid test, as well as other labs. And in addition to not just getting access, when you get the results, you also get a written interpretation of a given test and the relevant markers on that test with what are called action step suggestions that can be implemented based on the objective information of the test. You can go to labtestplus.com, look at the menu of labs, email labtestplus@gmail.com if you have questions. Autism Recovery System is a comprehensive biomedical intervention membership site for parents and caregivers of individuals with autism. Again, this website could be used for kids with ADD, ADHD, sensory processing disorders, other type of special need types of disorders. There's a tremendous amount of information in this site. There's videos, articles, there's an entire course called Autism Recovery 101. We have webinars that we do that we add to this site as well, and there's already a library of webinars, case studies. There's also an interactive forum. So a lot of people who are members of the site use the forum to post questions to me, sometimes on a daily basis, whether it's just trying to ask general questions or wanting me to look at a supplement, or, hey, Dr. Woeller, I'm seeing a behavioral issue with my child. What might this mean? Okay, the autismrecoverysystem.com website is a tremendous resource for you. You can also go to the autismrecoverysystem.com homepage and get access to this complimentary book called 7 Facts You Need to Know About Autism But Probably Were Not Told. And I'm always available for private consultations through my private practice. You can email to scmedicalcenter@gmail.com. Our website is mysunrisecenter.com. Okay, thanks so much for your attention in watching this presentation. I'm Dr. Kurt Woeller for Autism Recovery System. Thanks so much.